Kia ora, I'm Hillmare, Chief Economist at BERL. I'm joined this afternoon by Dr. Ganesh Nana, our Research Director, Nick Robinson, Senior Economist, and Amanda Reid, Senior Researcher.
Kia ora.
Government just presented their rainy day budget this afternoon. No surprise, of course, the focus is on keeping people in work through all probability a recession, with another $3.2 billion targeted at extension of the wage subsidy for another 8 weeks. We've seen $3 billion in infrastructure investment, with 8,000 new public homes being built and $1.6 billion for trades and apprenticeship training. Through this $50 billion budget, the government hopes to save 140,000 jobs. However, we will also see the government debt increase to 53% of GDP by 2024. So starting with this, based on this announcement, Ganesh, is it truly a transformational budget, this, or is it just a textbook reaction?
Oh, there's no way you could call it a textbook reaction. A $50 billion response and recovery fund is a large sum of money. So there's no way you could criticise it as being textbook. There's a few missed opportunities to make it truly transformational, but those numbers that you read out and talking about billions of dollars in terms of job programs across the environment, job programs across training and apprenticeship programs, and also some of the funds for housing, as well as whānau ora, as well as health, as well as school lunches. All of those things have added up, and as you say, we're debt is, well, we won't say blowing the debt, but debt is now going to be well over 50% of GDP from 20. It's still well below other countries, so I wouldn't be too concerned about debt. But I think the biggest disappointment is still the nil response in terms of benefit levels, and with by their numbers about another 130,000 on the dole, despite these budget announcements, which is just a signal of just how bad things are going to be. Another 130,000 on the dole, expected to rely on benefit levels that are totally inadequate, is going to be difficult for many, and I wouldn't be surprised to see further announcements about that fairly soon.
So based on this, and you talk about the training program and people on the dole, and these training program that they talk about of 100,000 people retrained from the hospitality sector. So Nick, all these various targeted programs that they have announced, what will actually be the focus?
Yeah, so the focus is going to be on keeping people in work. So interestingly, there was around 400 million to retain and retrain apprentices. So making sure a lot of our young people don't drop out of the job market through this, and so that they can continue working. There's also going to be around 300 million in support for free trades training. So this is opening up a lot more, previously just for school learners, but this is now going to be open for everybody. So it's a chance to improve the skills we do have. Other programs are also increased funding for tertiary education programs. So it's creating the skills we've got, we need to sort of get through this recovery. I think previously other recoveries have relied on bringing people in, but this one's going to, the skills are going to have to come from within New Zealand to make this recovery really successful. I think the packages are sort of aiming to keep the economy rolling with what we've got. One thing to note is in the agricultural sector, looking to retrain 10,000 people from sectors that have been heavily impacted. So tourism, aviation will be where a lot of the focus on employing these people comes from.
So based on this, it is quite a lot of money. And one of the other shifts that Minister Robinson also said that, we have the largest ever health increase in this budget. So Amanda, what does this actually mean?
Not a huge amount, to be honest. Some of the biggest increases were announced earlier this week with the 3.92 billion additional spend to DHBs. That's over 4 years. A lot of that funding is around meeting growth needs, so it's increased demand and making sure that actually our health sector is able to care for people's current health needs. There was also some funding for disabilities announced, enabling disabled New Zealanders to live good lives, and that's flowing on from last year's budget, so that's a 5-year spend. New spend is in publicly funded medicine, so that's another 10 million to Pharmac this year and 50 million each of the following 3 years. And some additional maternity spend, including 120 million over the next 4 years for implementing the maternity action plan. And lastly, there's some increased capital expenditure, which comes in line with their drive towards increasing infrastructure investment across health and education, which they announced last year as well.
So Menda, based on this, also looking in terms of health and education infrastructure is, what does the allocation to social services and social providers look like? Will it actually address inequality?
I don't think that that's going to meet our needs for inequality. In terms of their social service spend, a lot of that spend is towards family violence sector. We've got 183 million in family violence over the next 4 years, including increased funding to kaupapa Māori providers. Again, the disability sector is well supported with 43 million towards vocational and community groups and programs. And there's some additional funding to Heartland programs, which is about rural access to community services and government services, and that's largely funded through MSD. But a lot of these increases around again, meeting current demand as opposed to the greater increase in demand that we're going to see. There was a COVID response of 27 million for social services and community groups. And I don't see that carried through, especially given the increase in beneficiaries that we're expecting. I'm not sure that the increase in funding for social services is really in line with their targets around child wellbeing and reducing child poverty, because if you've got this increase in beneficiary numbers, people who are living on subsistence kind of wages, the social services spend is not going to support those families that are most at need.
Yeah, and I, just picking up on that, Amanda, I think that's one of the contradictions that is in this budget. And I suppose we do have to give credit. These are significantly large extra dollars to that sector, but in reality, it's very much funding the ambulance at the bottom of the cliff. And for example, there's significantly a large number of more dollars for food grant for the my mind's gone blank around the food providers.
School projects.
No, not the school project, the food banks. And they have been given extra, but as many will point out, it would probably have been cheaper to actually lift benefit levels to enable people to actually buy to afford their own food. And I suppose that's one of the contradictions that remains, I suppose, embedded in the system, that we still have this ambulance at the cliff rather than focusing on building the fence at the top. And to give the minister credit in the lock-up, when he was asked by the media about this, he said we need both. His response, we need both, and we're working on both. And he said, undoubtedly, given the size of the shop, we definitely do need to fund the ambulance. But it's, I suppose, disheartening that we're not focusing on that fence even more.
So I think in terms of looking forward and at the budget, these are some of our initial thoughts. We'll be loading some more in-depth analysis on the budget onto our website in the next couple of days. And a very special thank you to my colleagues, and we will talk to you soon. Kia ora.
Thank you.